Hello guys and welcome to our YouTube channel Cracking Dentistry. In the last video we discussed about the gingival cyst of newborn. Today we are going to continue our discussion on odontogenic cyst by discussing about the gingival cyst of adult. So today's topic will be discussed under the introduction, a histogenesis, clinical features, radiographic features, histopathological features, a differential diagnosis, and we'll end the discussion by giving you a brief idea about the various treatment modalities that are followed for this particular cyst. So gingival cyst of adult is actually a rare developmental odontogenic cyst which is derived from the cell rest of sere. Many authors consider this particular entity to be an extraosseous or a soft tissue counterpart of the lateral periodontal cyst. But however, many authors do not actually support this claim. Now, there is another variant of a cyst which occurs following the gingival graft that is done. But however, this group of cysts is not considered to be a variant of gingival cyst of adult and are merely cystic degeneration taking place in the epithelial inclusion at the site of the surgery. So moving on to the histogenesis, there are numerous theories that are put forward for understanding the histogenetic concept of this particular cyst. So among this, the ones which got lots of attention were the origin from the cell rest of sere, then from the traumatic implantation of the surface epithelium, cystic degeneration of the deep projections of the surface epithelium, that the cyst is derived from the glandular elements. The cyst is actually a continuation of the gingival cyst of newborn, and then that it is an extraosseous variant of the lateral periodontal cyst. Now, among all these theories, the origin from the cell rest of sere is the most accepted theory. Now, the origin from the traumatic implantation of the surface epithelium as well as its derivation from the glandular elements is greatly disregarded because of its lack of an evidence to support these claims. Now, the presence of certain keratinizing variants of gingival cyst of adult actually gave up to the conclusion that this cyst may be derived from the continuation of the gingival cyst of newborn, which has failed to undergo resolution. And the clinical predilection, that is, it has a predilection to the mandibular premolar canine region similar to that of a lateral periodontal cyst. So they said that maybe it is a soft tissue variant of the lateral periodontal cyst. Now currently the origin from the cell rest of sere, cell rest of Malacese, and that it may be derived from the basal cells of the overlying epithelium are the concepts which are getting lots of attention. But however, the source of epithelium is still unanimously considered to be from the cell rest of sere. Gingival cyst of adult can occur in any age, but it is most commonly seen between the 5th to the 6th decade of life. It does not have any specific gender or racial predilection and presents conventionally or most commonly in the mandibular canine premolar area similar to that of a lateral periodontal cyst. Now, this cyst is going to appear clinically as a well-defined painless dome-shaped swelling which is most commonly smaller than 0.5 centimeter in diameter. Rarely, it may reach a size larger than 1 centimeter also. The overlying skin or the mucosa of this particular cyst is going to have a bluish to bluish grey tinge. So radiographically, mostly this lesion will not give any radiographic appearance because it is purely a soft tissue entity. But however, when this cyst reaches very large size, it will cause pressure resorption of the underlying bone, giving rise to a sauceration or a cupping defect. Histopathologically, the lining epithelium resembles a reduced enamel epithelium and is composed of 1 to 3 layers of flat to cuboidal cells containing a darkly staining pycnotic nuclei and shows perinuclear cytoplasmic vacuolation. Now, there are localized areas of thickening in the epithelium which may mimic that of the epithelial thickening seen in the lateral periodontal cyst. and in few areas, the attachment of the epithelium to the underlying connective tissue easily peels off because the epithelial connective tissue interface is flat and devoid of any ratty ridges. So, this peeling of the epithelium from the underlying connective tissue gives epithelial discontinuities. Now, in few areas, the epithelium may be continuous with that of the overlying epithelium or the junctional epithelium, and this led to the confusion that it may actually be derived from the overlying epithelium. So, in this particular picture, you can see that there is a cystic cavity that is seen in the connective tissue with an overlying epithelium. Now, in the cystic cavity, you can see a very thin epithelium, and in focal area, you can see epithelial proliferation or thickening. So, in this next picture, you can see that the lining of the gingival cyst of adult is continuous with that of the junctional epithelium of the gingiva. So, differential diagnosis. So, the differential diagnosis of this particular cyst can be from a soft tissue variant of an odontogenic cyst like an OKC to a soft tissue counterpart of an odontogenic tumor, be it a benign or a malignant entity. So, by considering all these lesions, three entities are most commonly described to be this particular cyst differential diagnosis. The three being the lateral periodontal cyst, the peripheral giant cell granuloma, and the peripheral ossifying and odontogenic fibromas. Now, lateral periodontal cyst is a purely intraosseous lesion. So, radiographically, we will be seeing some radiographic changes, and on palpation, the lesion will be harder. Like you can have a bone, you can palpate the bone, whereas in gingival cyst of adult, it is going to be a soft cystic lesion. Now, the next differential diagnosis is the peripheral giant cell granuloma. So, the peripheral giant cell granuloma is most commonly seen in the facial gingiva, again in the portions anterior to the molar. So, in this peripheral giant cell granuloma, the lesion will be firmer on palpation rather than the cystic gingival cyst of adult. Histopathologically, the peripheral giant cell granuloma will show the characteristic Gren zone separating the lesional connective tissue from the normal connective tissue. Again, the connective tissue will show numerous giant cells and extravasated RBCs. There will not be any cystic change in this lesion. Next, in the peripheral fibroma. So, peripheral ossifying fibroma or odontogenic fibroma may clinically resemble this entity. Now, these lesions are also going to be fibrous on palpation, that is, they are going to be firm on palpation and will not have any cystic consistency. In peripheral ossifying fibroma, when you see histopathologically, there will be numerous bony trabeculae that is seen in the connective tissue. And in the peripheral odontogenic fibroma, we will see a fibrous stroma with numerous epithelial islands, odontogenic epithelial islands, and few depositions of cementum-like or dentine-like materials. So, this particular cyst is conventionally managed by local surgical excision. It has a very low recurrence rate and hence it has an excellent prognosis when the excision is done completely. Now, there is no cases reported of any malignant or neoplastic entity being derived from this particular cyst. So, these are our references. So, thank you for watching our video. So, if you liked our video, please press the like button and subscribe to our channel. Thank you.